Zoloft, sertraline, is the most prescribed antidepressant in the United States. About 15 million Americans are on Zoloft and 2.5 million more will start this year. But this leads us to a critical question that is often overlooked. If Zoloft and other antidepressants are so widely used, why are anxiety rates continuing to rise? Why are more people medicated than ever, yet still increasingly anxious? I'm Dr. Ayer, quadruple board certified psychiatrist. I've treated thousands of people struggling with anxiety, and I want to be clear about something before we go any further. This is not a video telling you Zoloft is good or bad. I prescribe it. I've seen it genuinely change people's lives. But I've also sat across from patients who've been on it for 3, 5, even 10 years, still anxious, still struggling, wondering why the medication that was supposed to help them never did. This message is meant for both groups, those who benefit and those who still struggle. Here's what we're going to cover: what Zoloft actually does in your brain, the side effects most people are never warned about, including one that causes thousands of people to quit in the first month, why it stops working for some people, and the complete treatment approach that produces real, lasting results. This information is crucial because answering why you're still anxious might depend less on your medication than on deeper factors at play. Let's start with what Zoloft does right, because it has many positives. Zoloft is an SSRI, a selective serotonin reuptake inhibitor. Serotonin is a chemical messenger that helps regulate mood, reduce emotional reactivity, and lower the sensitivity of your brain's threat detection system. With anxiety disorder, the amygdala, your brain's internal alarm, becomes hypersensitive. It starts firing at things that aren't actually dangerous. A deadline, a text you haven't received back, a strange feeling in your chest. The alarm goes off anyway. Zoloft helps recalibrate that alarm. When it works well, it creates enough stability that your brain stops treating ordinary life like a survival emergency. One of Zoloft's real clinical strengths is its dosing flexibility. It works across a wider dosing range than many other SSRIs, which means your doctor has more room to find the level that actually fits your biology. The recommended dose is 50 to 200 milligrams. I've had patients describe starting Zoloft as feeling like someone finally turned the noise down. They could think clearly for the first time in years. They could sleep. They could show up for their lives again. That is real. That matters. And for some people, medication is exactly the right first step. But there's something about what happens in the first few weeks in Zoloft that most people are completely blindsided by, and it causes a significant number of them to quit before the medication ever has a chance to work. Here's the one I want to address first because it is one of the most important: startup anxiety. Zoloft has a more activating profile than some other SSRIs. What that means in plain language is this: in the first 2 to 4 weeks, a lot of people feel worse before they feel better. Anxiety spikes, sleep becomes more disrupted. Some people feel more on edge, more restless, more wound up than they did before they ever started. I had a patient, a 44-year-old man, high-performing, years of unmanaged anxiety, who called me after day 5 and said he felt like he was losing his mind. He was ready to stop. I told him what I'm telling you now. This is the medication doing what it's supposed to do while your brain adjusts. It's usually temporary, so most people are able to push through with the support of their mental health provider. He stayed with it and was doing much better by week 2. By week 6, he described it as the first time in a decade he had woken up without dread. If nobody warned you about startup anxiety, it may feel like the medication is making you worse, and thousands of people stop right there before it ever had a chance to work. Beyond startup anxiety, there are other effects to consider. Gastrointestinal distress is common with Zoloft. This means it can be hard on the stomach. Nausea, loose stool, stomach upset, especially in the first few weeks. It usually settles, but it's worth knowing about. Sexual dysfunction, including reduced libido, delayed orgasm, erectile difficulty, and emotional distance, affects many on SSRIs. It's a common reason people quietly stop taking their medication without telling their doctor. If this happens, speak with your doctor. There are options. Emotional blunting is another. Anxiety quiets, but so does joy and motivation. Life can feel flat and distant, functional but not fully present. And discontinuation syndrome is real. Stop Zoloft too quickly and your brain reacts. Brain zaps, dizziness, emotional waves that feel like a relapse, increased anxiety. This is not weakness, it is neurochemistry. Always taper slowly and always with guidance. Here's what I want you to hold on to though. None of these side effects means Zoloft is wrong for you. They mean you need to go in informed, eyes open, with a doctor who's actually monitoring how you're doing. Let's shift to an important consideration: why Zoloft can stop working for some. This is the part that many never get told. Zoloft affects serotonin, a brain chemical that modulates mood. It does not affect cortisol. It does not reduce inflammation. It does not stabilize blood sugar. It does not repair mitochondrial function. And it doesn't address the hormonal shifts that, especially for adults in midlife, can quietly and powerfully amplify anxiety in ways that no antidepressant can counter alone. Think of it this way. Your nervous system is an engine running hot. Zoloft cools one part of that engine. But if the oil is low, the fuel is dirty, and the positioning is wrong, cooling one part doesn't stop the whole engine from overheating. Here's what's actually driving anxiety beneath the surface. 1. Cortisol dysregulation. When your stress response runs hot for years, your brain stops distinguishing between real emergencies and ordinary moments. Your cortisol rhythm inverts, wired at night, exhausted in the morning. No SSRI recalibrates that. 2. Chronic inflammation. Gut imbalances, insulin resistance, poor diet, disrupted sleep, all of it drives brain inflammation. And inflamed brains are anxious brains. Zoloft doesn't touch the inflammation. 3. Blood sugar instability. When blood sugar crashes, your body floods itself with adrenaline to compensate. That adrenaline surge produces racing heart, lightheadedness, and sudden dread, symptoms that are nearly identical to a panic attack. This is pure biochemistry. No antidepressant addresses it. 4. Mitochondrial dysfunction. Your mitochondria produce the energy your brain needs to regulate emotion and calm threat responses. Chronic stress, poor sleep, and poor nutrition all impair mitochondrial function. No SSRI restores that. And for those of you in your 40s and 50s, hormones change the entire equation. Estrogen decline in perimenopause directly disrupts serotonin and GABA, the brain's two primary calming systems. Declining testosterone in men is linked to increased anxiety, irritability, and stress tolerance. These shifts don't just add to anxiety, they change the biological foundation on which the medication is trying to work. This is why Zoloft can work for 2 years and then quietly stop. The drug didn't necessarily fail, but the underlying biology kept shifting, and the medication was never designed to help with that. One of the most powerful things you can do for all of these systems right now, and something Zoloft cannot do for you, is repair your sleep. Prioritizing sleep can directly improve anxiety, help medication work better, and support your body's entire stress response. I have a free sleep guide, and the download link is in the description below. To bring it all together, here's what a comprehensive treatment plan, including Zoloft, should look like. Zoloft can be part of recovery, but never the only part. Here's why I recommend you build around it. 1. Quality sleep. Every anxiety treatment works better when you sleep better. If your sleep is broken, nothing else works as well as it should. 2. Stabilize your blood sugar. Protein at every meal, fewer refined carbohydrates, cut down on ultra-processed foods and sugar. This single shift can make a huge difference in your mental and physical health. 3. Reduce inflammation. More whole foods, less processed foods, less alcohol. This directly calms the brain inflammation that worsens your mental health and keeps the nervous system stuck on high alert. 4. Move your body. Exercise is one of the most clinically supported anxiety treatments that exists. It lowers cortisol, increases BDNF, a brain growth factor that supports emotional regulation and recalibrates the nervous system in ways no medication replicates. 20-minute daily walks are a good start. 5. Targeted supplementation. Magnesium glycinate, omega-3 fatty acids, ashwagandha, and selectin, a clinically studied lavender extract, all support the biological systems that medication doesn't reach. 6. CBT. Cognitive behavioral therapy is one of the most evidence-based treatments for anxiety we have. Medication adjusts the neurochemistry. CBT rewires the patterns. You need both. And if you're in midlife, get your hormones checked. Testosterone, estrogen, progesterone, thyroid. These hormones are responsible for most of the biochemical processes in your body. If you're ready to address the deeper causes of your anxiety and take decisive steps toward lasting change, watch this next video.